We are able to identify and understand the use of laboratory apparatus. Second, we are able to explain the step-by-step technique of titration. Third, we are able to describe the chemical reagent used in their role.
The apparatus we use is clamp stand, burette, conical flask, white tile, volumetric pipette, pipette filter, volumetric flask, funnel, dropping bottle or pipette for indicator, and wash bottle which is distilled water.
I'm going to explain the function of each apparatus. The first one is clamp stand. Clamp stand used to hold the burette securely in a vertical position, so it won't tip over during titration. Second is burette. Burette is long, related glass tube with that it delivers precise amount of liquid. You also can control the drift to measure how much titrant used. Third is conical flask. It has a wide base and narrow neck, ideal for swirling without spilling. It placed under burette to catch drop. Fourth, volumetric flask. It's designed to hold one exact volume. It's used for making stable solution by dilution.
Function of each apparatus. For white tile is to place under the flask to make the endpoint color change easier to see. For volumetric pipette, calibrated to measure a fixed volume very accurately and used to transfer a exact amount of solution. For the last one is funnel, helps pour liquids into the burette or pipette without spilling.
The reagent used for this experiment is HCl, which have 0.1 molarity. It is used as a titrant in burette. Second is NaOH, also have the same molarity as HCl. It used as an analyte in conical flask. That is phenolphthalein as an indicator to see changing colorless to developing at pH.
In this video, we will be going through the step-by-step procedures on how to carry out titration. Firstly, ensure that you have all the equipment you need for this experiment in your basket, as seen in the first video of this series. Take the burette and the pipette from the side bench and clamp it onto your retort stand. Next, remove your pipette from the stand and wash the insides of the pipette with distilled water. This is done to clean the pipette from any debris. You will only need to fill the pipette a third of the way through for this step. Gently close both ends with your gloved hands and tilt the pipette. Wash the bulk of the pipette. Now dispose the water into the sink. Repeat this washing process with the acid. Once done, it is now time to fill the pipette with acid. Transfer 25 ml of the acid into the pipette using the pipette filler. Next, transfer the 25 ml of acid into the conical flask. Next step will require you to add the indicator if needed. Be sure to add 2 to 3 drops. Next step involves washing of the burette. It encompasses the same steps as the washing of the pipette. Remove the burette from the stand and use the distilled water bottle and fill the burette a third of the way through. Again, cover both ends with your gloved hands and wash the insides. Be sure to rinse the tap as well. Now repeat these steps with the alkali. Once done, return the burette to its stand. Now it's time to fill the burette for titration. Pour some alkali into a beaker. approximately 70 to 100 ml will be sufficient. This time, fill up the burette until the 0 ml mark at the top. You may want to place the entire setup on your chair to avoid parallax error when filling up the burette. Be sure to get rid of any air bubble in the tap of the burette. As mentioned in earlier videos, you can do so by opening the tap and allowing the alkali to flow through. Be sure to place a beaker under the tap so that the alkali does not spill onto the table or chair. Once completed, place the entire setup back onto the table. Be sure to remove the filter funnel before titration. The presence of the filter funnel on the burette may cause inaccurate readings. A drop or two could trickle from the funnel into the burette. In titration, a drop or two could mean the difference between a successful and a failed titration. You should be ready to begin titrating now. Now place the flask underneath the tap of the burette. Remember to place the white towel underneath the flask. This will help you get a better assessment of the color of the solution in the flask. You are now ready to begin your first draft. The objective of this draft is to get a rough estimate of the endpoint. Open the tap of the burette and let the solution trickle through into the conical flask. A rate of 2 drops from the burette per second is a good estimate to be working with. Once the solution changes color, indicating the endpoint has been reached, turn off the tap of the burette. Note down the rough reading in your burette onto your worksheet. That is the end of your first trial. Once ready, you may begin your second trial. You may need to fill the burette up to the 0 ml marking again. Feel free to skip this step if you feel that there is enough solution in the burette for a second titration. Either way, note down the initial volume in the burette. Now that you have a rough reading for the endpoint, release all the liquid until you are 1 or 2 ml away from your endpoint. Afterwards, it is crucial that you release the liquid dropwise from the burette.
For safety precaution, we need to wear lab coat, gloves, and safety goggles. Second, we need to read burette at eye level to avoid parallax error. Third, we must handle acid and base carefully to prevent spill and dispose of chemical as instructed.
This is example for this experiment used in our real life. Firstly is to know quality control in fire detector. Secondly is testing water hardness. Lastly is determining the acidity in vinegar or
Conclusion: a correct use of apparatus ensure reliable data. Mastering technique to improve precision. Understanding reagent helps interpret chemical reactions.